Five has two parts to it. 5 is muscles of mastication. Okay, 5 is muscles of mastication, which is your temporalis and masseter muscle, temporalis, masseter. So you have bite down. Okay, good, relax. Bite down. Okay, and you can feel it tense up. And you just ask them a question, you get jaw claudication. When you chew it, you really get tired and weak. Right? Next is it's sensory to the face. It's sensory in 3 areas. You have the ophthalmic, that's what I call a trigeminal. The ophthalmic branch, the maxillary branch, and the mandibular branch. And you just check all 3 sides. Now you have here a...
just checking to see if I feel that?
Yeah. So can you feel light touch? So can you feel it, feel that? And then, see if you get a nice little spike going there. Okay, sharp pain. Is it sharp or dull? Sharp. So you just don't want to draw blood, right?
Get close to it.
Yeah. So that's 5. We already did 6. 7 is muscles of facial expression. Muscles of facial expression. So wrinkle it for you. Open your eyes as wide as you can. You're looking for symmetry right here. Okay, if this was flat, wrinkle it up again. If this was flat on this side, then not over here, that's a sign of a nerve problem, which I gave you the hand on 7, that we'll talk about next class. All right, so you want to make sure it's symmetrical right to left. Okay, close your eyes as tight as you can, real tight, and you try to open his lids up, blow your cheeks out. Okay, show me your teeth. All right, you want to see, is it symmetrical left and right? If somebody's got a facial droop, all right, so you're going to see if something's wrong because one side is not the other side. So and then you have to decide, is it a central nerve or is it the peripheral nerve as it exits, all right? And then that gets into a stroke versus Bell palsy. We talked a little bit about that the other day. So that's 7. 8 is hearing. So normally what I do is I just do this. Can you hear that? Hear that? Can you hear me now? But they got what's called the Rhine and Weber test. I don't know anybody that does it, but you want to, you can. Nobody does it anymore. It's a Rhine and Weber test. What you're looking at, you got air conduction versus bone conduction. Okay, so what you do is you ring it. Okay, tell me when you can't hear it anymore.
Put it on the mastoid.
You can't hear now? So the air conduction is greater than bone conduction. If he had some damage here, okay, and if he didn't hear here, you take it off here and he didn't hear here, that means air conduction is bad, but he's got good bone conduction. Air conduction should be greater than bone conduction. So it's just looking, what are you dealing with? You just send him to the ENT.